especially in Harris County. Joining us right now live is Houston Fire Chief Sam Pena. Chief Pena, thank you so much for joining us this evening.
Yeah, thank you for having me, and hello to your viewers.
Thank you. Thank you. Chief, we want to get to some questions for you, but first we want a status update check on the Houston Fire Department. How are operations going thus far during this very challenging time?
Well, Mia, first of all, again, thank you for having me on your program. And what I can tell you is that the Houston Fire Department right now is fully operational. We're able to staff all our apparatus right now, but it is becoming increasingly strained to be able to do that as more of our firefighters are being infected as they come, as more of this virus spreads through our community. Our firefighters, first responders are more apt to be exposed, and we are seeing some of the impact of that.
You guys are right there on the front lines. You're answering those calls for help. Tell us, do the firefighters have the personal protective equipment that they need in order to respond? Of course, talking about those masks, gloves, whatever other equipment they may need.
Right. So we have been very fortunate here in the Houston Fire Department, and that we were able to come into this operation with a healthy supply of equipment for our firefighters. And the reason for that, Mia, is that regardless of the strain of flu that we may be dealing with each year, it is our responsibility to provide our firefighters with the personal protective equipment and tools that they need to safely do their job. So last year, we were able to secure enough personal protective equipment. That's the masks, the goggles, the gloves, the gowns, in anticipation of last year's flu season, which carried over now into this year. And so we were in a much better position than a lot of other agencies, and certainly a lot of other departments across the nation. And we have been very successful through the incredible work of my staff, and in that we have been able to secure enough equipment to maintain full operations for our firefighters. We haven't run into an incident or an issue up to this point where we don't have enough equipment to handle the call volume and the demand for service. So again, we have been very fortunate in that respect, but that's through a lot of hard work that our staff has been doing. I've been making phone calls as well to various vendors, and we're looking far and wide for this equipment because it's a worldwide shortage of this equipment, and it's high demand. And so, look, we found some gowns where we were running critically low on in Mexico, and so it doesn't matter where they're coming from. We're looking to ensure that we maintain adequate supplies on our shelves to be able to serve this community.
Chief, that's very promising to hear that you have the PPEs that you need and that you're continuing to make sure that you maintain the proper numbers and don't go short on those. Update us, though, on your firefighters. How many have you had who have been diagnosed with the coronavirus at this point?
Right. So look, we're dealing with an invisible threat right now, and this virus is really no joke. I mean, time will tell how deadly this virus is or will turn out to be. But one thing we know for sure is that it's incredibly infectious, right? And it's easily transmitted. And our firefighters are out there on the front line. Firefighters, paramedics, our police officers, all the city employees and providing service, our doctors, our nurses. We're out on the front line, and it is having an effect on us. For the fire department, I can tell you that right now we have 154 firefighters that are in quarantine for a possible exposure to coronavirus. And we have tested about 36 firefighters that have developed some symptoms for coronavirus. We've tested 36. 19 of those tests we've gotten back, and 8 of those firefighters who've been tested have been positive for coronavirus to this point.
Chief, is that promising to you, considering just how big your department is and how much work you're doing right now, to have the number at just 8? How thankful are you for it to be under 10 at this point.
I know. Well, considering the fact that we are, look, any exposure to our firefighters is a huge concern for us. I have to say that because it's one of the things that is constantly on my mind. What can I do to protect our firefighters so they can safely do their job, right? But considering that we are the primary agency delivering the emergency service to this community, the emergency medical service to this community, the fact that we only have 8 that are tested positive for coronavirus in really a pandemic, and it's the widespread infection in this community is and to have only 8 is really a testament to the excellent work that our firefighters are doing in ensuring that they're protecting themselves, and that's critical. You know, we will work day and night to ensure that we're providing them the equipment. It's on them to ensure that they're properly using the equipment. And what I've seen to this point is that they have in fact done that, and that's an incredible testament to their professionalism and to their care of this community. Because look, if we're infected, we can be a source of infection to our patients, and they take that very seriously. Our firefighters do, and so look, I speak highly of them because they deserve it. They really are doing heavy lift, and they've been doing an outstanding job of ensuring that they're protecting themselves, staying healthy, so they can stay on the job and protect this community.
All right. If you're watching, we just want to update you that we are visiting with Houston Fire Chief Sam Pena right now about the Houston Fire Department's response to COVID-19. They are very much on the front line answering many of the calls that come in from people who feel as though they have come down with the virus and have symptoms. So if you are joining us, whether it is on Facebook, on YouTube, on khou.com, we'd like to get your questions answered. So please let us know if there's anything that you have that you want the chief to address. In the meantime, Chief, I want to talk about the stay home work safe order. It has been extended now to the end of April. What does that mean for the fire department and your continued efforts and operations?
Yes. So one of the impacts that the stay home order has had for us is that as far as call volume, our call volume has remained essentially flat. We run about between 900 to 1,000 calls per service every day, and that is maintained at that level. One of the things that we're finding is that our motor vehicle accident calls have dropped because there's less people on the roads, and most of them are adhering to the request to stay home and to practice the physical distancing. That's really going to help us try to tamper some of the spread down. But the fact that they're staying home, that they're not on the roads, has decreased the number of vehicle accidents, which was the number one call type for our system. But the fact that we've remained flat as far as call volume means that something else has filled that void, and those are medical calls. And it's as expected. But look, so continuing this stay home order, I expect more of the same. But I also expect a small uptick in the call volume, because as more people become infected, as this thing spreads, more people are going to be calling for help.
Chief Pena, talk to us about, when people are now calling for help, what warrants the firefighters, paramedics going to the scene in person?
Well, that's an excellent question, and I think having the information and us doing a better job of putting out the information as far as what this illness, what we're seeing, right, as far as the impact of this virus, and what we're seeing is that up to 80% of the number of people that come down with the coronavirus are not hospitalized. And what they've experienced is between mild and moderate symptoms of the flu. And so most of these cases, the majority of these cases, would require certainly making contact with your primary care physician, but it doesn't necessarily require an emergency transport by ambulance, which is the most expensive taxi, so to speak, right, to the most expensive part of the hospital, which is the ER. And what we want the community to know is that if you're experiencing symptoms of coronavirus, and the big three are a cough, fever, or shortness of breath. If you're experiencing any of those, make a phone call to your primary care physician, and they will assess the needs, right, of the next steps. That's for the majority of our patients. But if you are experiencing a medical emergency, whether it's related to the coronavirus or not, if it's a medical emergency and you feel that you need to call 911, don't hesitate to call 911, whether it's a medical emergency or a safety and security emergency for police department. I mean, that's what we're here for. But we do want the public to be cautious and judicious about how they use the 911 system, because we, just like the hospital system can be overwhelmed, we can overrun the 911 system. And in certain instances, it's happened. You know, we have very limited surge capacity right now. We don't have extra units. Everybody's busy. And so when we're making phone calls or calls for low acuity type events, that takes resources out of the game, and it puts additional stress on the system. And it could end up where we don't have units available for that true emergency. So that's one of the things that we're having to. That's system wide. That's all the time. It's just the proper use of 911. But again, I don't want from calling and using the system. That's what we're here for. We will ensure that we're getting there in a fast and prompt manner, and to attend to your needs.
Right. And Chief Pena, to echo back on what you were saying, and in educating people about calling 911 and for firefighters to come out and assist, what if they are in fact gasping for air and show those other signs of having COVID-19 or coronavirus, that high fever? What should they be letting the 911 operator know so that the firefighters are aware of the situation?
Yeah, so when we first started this, Mia, or went into this operation, you know, we had certain classic signs that we were looking for, and we made immediate changes to our 911 intake, the queries that we would ask when people call 911. And we were asking for signs and symptoms of the flu, certainly, and if they had traveled outside the country. But at the point where this thing started, we started having more community spread and more people were infected. The travel issue was, that question was really irrelevant at that point. And what we were asking then, and what we keep asking the public now, is if you call 911, we need you to please tell the call taker if anybody in your home is having symptoms of the flu or coronavirus. And again, the big three are cough, fever, and shortness of breath. Let us know, because that prepares our firefighters to better serve the public. And what I want to make crystal clear is that you letting us know that somebody may have be infected with the virus is not going to slow the response. We're not going to take it any slower. All that does is it prepares our firefighters, and it heightens their sense of awareness to be able to don their protective gear before they go in, and be safer for everybody around. Now, having said that, we've recently made some changes to our deployment profile and protocol. Now, the assumption is, and the direction we've given our firefighters is, assume that every patient you come in contact, regardless of the call type, is or may be infected with the coronavirus. And what they're going to be doing now, and this is what the public can expect, Mia, is we're going to send the minimum number of people to your call to service the call. And one firefighter is going to do a distance assessment of no less than 6 feet. And they're going to assess exactly what it is that the medical emergency requires, right? And then they will in turn bring in additional resources, the firefighters, to suit up and handle that call. And that is, again, to try to prevent infection, certainly to our firefighters, but it also protects the patient, because we don't want to be a source of infection to our patients either.
Exactly. Chief, want to get to a few viewer questions and comments right now. Maggie Prokos, first of all, she wanted you to know my prayers for our men and women on the front lines. Maggie, thank you for that. Maggie asked, Chief, how does the stay-at-home order change? Any additional closures happening? As one of our city leaders, can you address that for us? How does the stay-at-home order change today? I presume she's talking about the announcement of the extension of stay home, work safe.
Right. So I haven't gotten a chance to fully read through the new order. I know it was extended. I can tell you what we were working under in the previous order, the one that was just due to expire at the end of this week. And because we, the fire department, the fire marshal's office, was in charge of enforcing the county's order at facilities. And what we were doing is essentially any non-essential business was we were approaching that business if it was remaining open. And the goal was to, one, educate that business and inform them about the county's order and explain to them the why, right? And the why is that we know that this coronavirus, is highly infectious, and one of the ways that we were going to be able to tamper and slow the spread of the infection was to physically distance from each other, and that was the purpose of the order, is to ensure that people remained at home, that businesses, we avoided any congregation, any big groups that in itself caused the spread of this virus. And what I anticipate that this thing is going to do, it's certainly affecting our businesses, right? And so we cannot dismiss that. And some of these small businesses are really hurting, and so that's a concern too. And I know it's a concern for the mayor, and I imagine it's a concern for the county judge as well. But their focus is on the protection of the health and safety of our community. And really, without being too overly dramatic, it's about saving lives, because we still don't know what the full impact of this virus is going to be. But we know that it can be deadly, and we certainly know that it's highly infectious. And that's the whole purpose of this stay-home order, is to try to separate each other for a bit, until what that does is it allows the hospital system to maintain capacity for those critically ill. It also allows for the healthcare industry to find vaccines and appropriate treatments, right? It allows for those types of deals to be developed and put into the market so we can better manage this virus.
And the stay home, work safe order, Harris County Judge Lena Hidalgo extended today through April 30th. So if you were just joining us and wondering about the stay home, work safe order extension, it is through April 30th. And you mentioned that the fire marshal's office is the one who responds to essential businesses and if there's a question of people being in operation or not. Chief, just very basic, can you explain to the viewers essential versus non-essential?
So they put out a list of the 16 essential businesses that will remain open, or anything that's associated with those types of businesses. Certainly, healthcare will be open. Public safety will be open. The critical infrastructure items, petroleum and certain items that we need. The food industry, grocery stores, restaurants for takeout orders, and any of those items are the essential ones. We're finding now that some of those, because of state law or whatever else it comes into play, are also deemed as essential. For example, gun stores. Those are now considered essential. So there are other types that don't really fit into the 16 that were outlined, but we're taking them on a case-by-case basis. And again, my thanks is to this community, because they have been very compliant. Once we approach and once we communicate and try to educate on what we're trying to do, they have been very responsive, and they've been very accommodating in understanding what this community is trying to do to try to address this crisis.
We are talking to Houston Fire Chief Sam Pena. Chief, sharing some more viewer comments and questions. Patricia Fuentes says, God bless y'all. We are so thankful for y'all, talking about the Houston Fire Department there. We are also hearing from Dewana Tolbert. She wants to know, Chief, will a firefighters quarantine in hotels? Will firefighters quarantine in hotels?
Will they quarantine in hotels?
Yes.
So we are, yes. The answer to that is yes. We do have 22 firefighters quarantined in the hotel, and that is a facility that we've been able to secure to house those that have not been able to quarantine at home. Now, based on the CDC's recommendations, the International Association of Fire Chiefs, other associations, the best place to quarantine is in the home. It's more comfortable. It's easier to support, right? But if you cannot meet certain guidelines that the CDC has outlined in order to be able to quarantine at home, if you have elderly relatives that may have health issues or immunodeficiencies, relatives with immunodeficiencies, or small children, the CDC is pretty clear as far as what has to be made. Any individual, any employee of ours that cannot maintain those safeguards and quarantine at home, we have put them up in a hotel, and they'll remain there for the 14-day quarantine. And so, yes, look, it's important to ensure that we're providing for our firefighters to give them every opportunity to safely serve out the quarantine, because in the end, for them to be healthy and for them to come back and into the game.
So very important it is. Chief Lucas Ray asked, should people get tested for the virus just for peace of mind, even though they don't have any symptoms?
So that's not recommended right now. And from what I understand, and I'm no doctor or anything by any means, but what I understand is that the test, in order for that to give you an adequate answer, is there has to be an immune response from your body in order for that test to be accurate. Those patients that do not display any symptoms, you may get a false negative, right? If you don't have any symptoms, the test may come back saying you have no coronavirus, and a day later you start developing symptoms and you do have it. So right now, the medical community, and the advice we've been getting from our medical director, is that anybody that does not display any symptoms should not be tested until the time that they develop coronavirus symptoms. One of the things that I want to assure the community, Mia, is that we've tested 36 firefighters, and those 36 firefighters are those that have been in quarantine and have displayed symptoms. Out of the 154, 36 have been displayed symptoms, and we've tested them. And to this point, any firefighter that's required testing under the direction of the medical director and the CDC guidelines has been able to be tested. So we've had no problems in getting our first responders tested. I believe it's the same thing for the police department. Any first responder, police or fire, that needs testing has been able to get tested. And like I mentioned earlier, out of the 36, we've already gotten 19 results back, and 8 of those have been positive. And again, I don't want anybody to be infected with this. But the fact that we've had 8 when we run almost 1,000 calls for service each day is an incredible show of the diligence that our firefighters are displaying in protecting themselves and protecting this community.
It sure is. Chief, a couple more questions for you, because we know you have important business you need to get to. We just want to reiterate for people, once again, the stay home, work safe order for Harris County, which includes the city of Houston, has been extended to April 30th. And with that said, it brings us to a question from Diana Essex. She says, can we take a drive on the road, highway, as long as we don't get out of our car? And Chief, I know you said earlier you guys have had, or the Houston Fire Department rather, has had less vehicular calls to respond to.
Right.
I think this has to do with a lot of people still trying to understand the stay home, work safe order. Can you tell us from your understanding, is it okay for people to take a drive on the road, on the highway, as long as they don't get out of their car, as Diana Essex asked?
Look, what we would recommend is that if you don't have to be on the street, don't be on the street. Don't be out in the open. But if there's any that the rule doesn't allow you to go out and take a drive. Now, anywhere you go, any of the surrounding counties are also on this stay home order, right? Or something similar to it. So there's not many places to go and stop and see. So look, there's nothing preventing people from getting in their car and going out and taking a drive or going for a walk. As long as we maintain that physical distancing, because that's going to be critical to ensure that we are able to weather this crisis.
Yes, Dr. Fauci, a head member of the White House Coronavirus Task Force, said today that social distancing is working, and it could be the thing to see us through this. Chief Sam Pena with the Houston Fire Department, we want to thank you so very much for your time this evening. And of course, we are always thinking and so thankful for the Houston Fire Department and our firefighters. Thank you so much.
Mia, thank you, and thank you, public. And look, everybody has said it. We're in this together, but we really are. And we're going to see better days. I truly believe that. And we all need to do our part to ensure that we get there sooner than later.
Indeed, we will get through this. Chief Pena, thank you so much for your time. And folks, we'll see you back here for KHOU 11 News at 10. Remember, you can always get all of your information on the KHOU 11 News app, KHOU.com, and on YouTube any time of the day. We'll see you soon.